10, 15 seconds. Just waiting for. Okay, I think we are live now. Okay. Bismillah, alhamdulillah, salatu wassalamu ala rasulillah. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Assalamu alaikum, brothers and sisters. Welcome to this webinar on COVID-19 vaccine. So following on from the session we had in Tamil on the same subject last week. So this one is still on the same subject, but delivered in English. So alhamdulillah, so we have a panel of speakers or experts in various fields, inshallah, to take you through and inform you and then take your questions. So just to introduce, the purpose behind organizing this. As you know, this is organized by SLMCC in collaboration with the NHS Muslim Network, Al Barak Youth Foundation, and British Islamic Medical Association, BIMA. So I think we got representative from BIMA and Muslim NHS Muslim Network. Yeah, so you have a real panel of experts, inshallah, to educate us and then take your questions. And as I said, so the purpose behind this is, you might be thinking, so I think it's almost now 12 months. It'll be 12 months in March, experiencing this pandemic, COVID-19, and then now obviously vaccine has been rolled out. And then the sad reality is we still have genuine concerns and questions, talking to people individually and then friends and community. So we need to ask the question, why is that? So we've had, I know there's so many seminars organized, I think, throughout the country. So this is obviously, we're doing it focused on our community in Harrow. And I'm sure many people have attended other webinars and sessions on this. And despite all that, and then obviously information on YouTube and social media, we still have people with doubt and genuine concerns. So I think that's individually, you need to ask ourselves, we need to ask ourselves, are we going to the right people? And are we really, asking for going to trustworthy people? So just like, the question I ask myself and within the circle is, look, if you have a problem with your car, you would go to your mechanic. Everyone I'm sure you have a mechanic that you go to every year. And then the same thing with any, illness, you would go to your GP. So these are our trustworthy go-to people. So why is that when it comes to, this COVID-19 and vaccine? Unfortunately, it looks like we abandon the experts, we become the expert. And then we rely on YouTube and social media, these sound bites to make a decision. And I think that really that needs to be questioned. And especially as Muslims, as believers, Allah asks us to use our intellect and follow trustworthy sources. And that's the reason behind organizing this. So we've got, alhamdulillah, trustworthy members and experts from the community. I'm sure you would recognize all of these people. And that's what God expects us to do. Get your information from trustworthy people and experts in their own field. Surely 10, 20, 30 years of experience must worth something. Surely you can't compare that to, two YouTube clips or an hour of YouTube, video. You can't expect to become an expert and say that something that an expert with 20 years of experience doesn't know. So, and I think that would be my humble advice to all of all the brothers and sisters who have joined us for this webinar, and we have a Q&A at the end as well, and throughout the session the chat facility is enabled, So you can post your questions as the speakers are, so I think we have 3-4 panelists who will give us sort of like a 15 minutes update on various aspects related to the vaccine and then the latest on COVID-19. So I think without further ado, so this is just an introduction. So we have Brother Hesam, who will be chairing this webinar and then taking you through to the end of the webinar. So so over to you, Brother Hesam, who will introduce the panelists and take you through.
Jazakallah Zafi. Bismillahirrahmanirrahim. Alhamdulillah wassalatu wassalamu ala rasulillah. So as Zafi mentioned, my name is Hisham Malik. I am the co-chair of the NHS Muslim Network, and I also work in the medicines team at NHS England and Improvement. The way that this format will run today is we're going to hear from Dr. Kamal Nasser, inshallah, to talk about the clinical perspective of the vaccines, giving us an overview of what we need to know regarding the clinical side of things. After that, we will then move on to Sheikh Yunus Dodwala, who is the head chaplain at Bart's NHS Trust, and he will be talking us through the Islamic angle, any fiqh considerations we need to consider as part of the vaccines. We will also be joined by Dr. Azza Al-Naim, who is a public health registrar at Harrow Council, and she will also be giving us an update on the local rollout, inshallah ta'ala. So without further ado, we have a very packed agenda. I will hand over to Dr. Kamal Nasser. If you could just briefly introduce yourself as well, that would be fantastic.
Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Kamal Abdul Nasser. I work as a consultant physician at Sherwood Forest Hospital, that's in Nottinghamshire. So for the last 12 to 14 months, we have been working with COVID patients. And we have been carefully and closely monitoring the new developments and research. So I think I would like to give you a very short presentation. It's about 10 to 15 minutes. So I wouldn't be going into lots of technical details, but I will try to summarize and then we can discuss things during the question and answer sessions. Before starting, I would like to say, as a Muslim, I wouldn't tell something or I would preach something which I wouldn't practice or I wouldn't take it for family. I have already taken my vaccine. I have taken 2 doses of the Pfizer-BioNTech vaccine. So I have all I can talk about it because I have already taken it. Before starting, if I don't tell you briefly about COVID and some answers to your questions, it wouldn't be correct for me to going into vaccines. Some people think the COVID pandemic is not true. It's a myth that is created and sent through WhatsApp and Facebook and YouTube. It's a true pandemic we have seen with our own eyes. We have been handling for the last about 14 months. And some people think these deaths are being exaggerated. That's not true. We are seeing deaths every day in the hospitals. And we keep getting all the data in every hospital every day. And really speaking, if you see the number of deaths reported, that's a slightly underestimation than overestimation, because some of the PCR negative patients with COVID are not reported as COVID. And you would have seen videos in YouTube and social media that the hospital corridors are empty, and why they call it a pandemic. Yes, hospital corridors can be empty. It's because we are not allowing any visitors. We are not bringing down the clinic patients to the hospitals. We are doing telephone consultations or video consultations. And also the normal patients like fever, cough, chest pain, minor illnesses, they don't come to the hospital. So our corridors will be empty, but our wards and the ITUs are really, really busy. And why Southeast Asian and the Black communities are more affected? There are so many reasons. I don't want to go into details, but the truth is that the Southeast Asian community especially the Muslim community, is disproportionately affected. And if you look at the deaths, the number of deaths are very, very high among the Muslim community. Some reasons are very, very obvious. I don't want to go into details. And then I should briefly tell you about long COVID and the young people, because the vaccine will be relevant to them. If you get COVID now, sometimes you might carry on with so many symptoms like tiredness, lethargy, unable to work, aches and pain, memory loss, and so many things, sometimes heart-related, lungs-related, neurological symptoms. These can go on, and we don't know how long it's going to persist and how long it's going to go on. And we don't know after many years what complications you are going to get. Therefore, as a young person, you cannot say that I'm not going to die of this. The COVID-19 infection will settle down. I'm not going to die, so I don't need a vaccine. That's not true. You can still get long COVID syndrome. And more than that, if you are young, you should get the vaccine to protect the vulnerable and the old people. So as a Muslim, especially as a Muslim, you have a responsibility to protect others. Therefore, you cannot say that I'm young and I don't need a vaccine. So this photo I showed you, and briefly, what are vaccines? Vaccines are, some people, I do a lot of educational programs in Tamil, and the commonest question asked was, is vaccine a treatment? It's not a treatment for COVID-19. It is a preventive measure, and vaccines, when it's injected, they reach your your cells, and then they create the immunity against the virus for a short period, but they sensitize your immune system so that if you get the infection again, the immune system would know that this particular virus is coming, therefore it will produce antibodies and prevent your infection. Some vaccines just would prevent infections, but some vaccines would not prevent infection, but it will prevent you becoming sick. At the initial phase of the vaccine introduction, we thought it's not going to be protecting you from infection, but it will protect you getting severe infections. But now there's enough data that it can prevent infections, and also it can prevent you spreading the disease. So that's a very good data. We had about 2-3 trials coming out recently, so all indicate very good information that it's going to prevent infection, and then it can also prevent spreading of the virus. So we have 2 vaccines approved in the UK. One is Oxford vaccine, and the other one is the vaccine produced by BioNTech and Pfizer. It was originally developed by BioNTech. I just wanted to tell you this BioNTech vaccine, or the Pfizer vaccine, was developed by 2 Muslim scientists. Both they were husband and wife, Professor Sahin and Turesi. They were originally from Turkey. Why I'm telling that they are Muslims is that there were messages spreading that this is a Jewish conspiracy. We have a habit of putting everything down to Jewish conspiracy. So if you look at the work done by these 2 people, it's enormous and highly technically advanced work. They started working on this mRNA technology from 2010. This mRNA technology is being used in cancer treatment, and they are looking at developing many other vaccines, including multiple sclerosis. So it's going to be one of the technologies going to be used in the future in medicine, in many other conditions, not only in vaccines. How is a vaccine developed? How the research is done? I've shown here in this picture. Initially, there'll be preclinical studies. It will be studied in animals. I'm stressing this fact. There were messages spreading in social media that is mainly reaching not the white population, the minority ethnicities in the UK. Therefore, I should briefly explain this, how this research is done. They usually test with animals. They test in animals, and then if you look at the Oxford trial, they used the vaccine in animals, and then they exposed the animals to the virus and checked whether they are resistant to this infection. So they can, is the vaccine working in animals? It was working in the animals, and then it moved to the human trials. That means you test in people, original healthy people. And the phase 1 trial will be done with a very small number of people. And then the phase 2 trial will be done with many hundreds of people. And then there'll be a phase 3 trial. If you look at the Pfizer-BioNTech trial, they used about 40,000, or I think 44,000 people. They were all volunteers, healthy volunteers. And then Oxford trial, they used about roughly about 20,000 people in the UK, and South Africa, and they used many other countries as well. So the phase 3 trial is the one which is going to give us all the data about how safe it is, whether it works, what percentage of people will be protected, and all the information will be given. If you look at the data, from the Oxford trial, it showed about overall about 70% protection from infection, but the Pfizer-BioNTech study showed it's about more than 90% protection from infection. But the way these trials are done, people do slightly differently. The BioNTech data was collected slightly different to how the Oxford trial was done. So it was very, very difficult to compare whether these percentages are comparable. Therefore, we were looking for real world data, which is now available. I'll be telling you what's the real world data after vaccination has been done in countries like the UK, US, United Arab Emirates, and Israel.
Dr. Kumar, can I just add, your screen,
yes.
Your slides are not on the screen. So are you able to share your screen?
Oh, yes. Yeah. Can you see the screen?
Yes, we can. Yep.
So I will just show you these slides again. This is how the research is done. Animal studies, then phase 1 studies, very small group of people, and then phase 2 study, about 200 to 400 of people, and then thousands of people in phase 3. So that's what was completed, and then the vaccines were approved. So the commonest question people ask is, usually these vaccine trials takes about 10 years, 5 to 10 years. Why this trial was completed within a few months or within a year? There are quite a number of reasons why these trials were completed within a short period. If you're normally developing a vaccine, say for say mumps or polio, no one wouldn't be worried. No one would be going as a volunteer, or no one would be interested in funding them. But in this case, this was a pandemic. People were dying in thousands. So it's worldwide. Therefore, funding was very, very good. Every government was ready to fund. The UK government funded the Oxford trial. And then there was a very good cooperation between scientific teams, and the data was shared and the information was shared within the countries and universities and scientists. So therefore, it was very easy to develop a vaccine. And then we had some prior knowledge about the SARS-related viruses. We had SARS infection in 2003. And then in 2012, we had in Middle East, we had MERS infection. So these were quite related viruses. It's mutations of COVID, the coronaviruses. Oxford University has already developed a vaccine for MERS. Therefore, they had prior knowledge, and therefore it was easy to develop these vaccines. And then, as I said, the availability of volunteers, because it's a pandemic, people were ready to volunteer themselves. That's a very, very good thing about people in this country, and most of the Western countries. People very quickly, you can collect hundreds and thousands of volunteers to take part in a study. And then infection rate was very high in the communities, and therefore we could get enough patients. Say, if you are trying to develop a vaccine for polio virus now, you would have to go to Pakistan, because the only country that is having infections in the world is Pakistan now. So you would have to wait for 10 years, maybe more than that, maybe 20 years. But with this COVID infection, we had enough patients, thousands and thousands of patients. Therefore, it was easy to do the trials. Therefore, you didn't need 5 years or 10 years. And then independent regulatory bodies of the governments like UK or the US FDA or whatever the government agencies, they were continuously analyzing the data as it was collected. So therefore, they were able to have an idea of what's going on, and then they were very quick to give approval for these vaccines. Therefore, for all these reasons, I can say no corners were cut, and it was genuinely researched, and safety was the most important thing. And then the effectiveness, both were confirmed with these research trials and were approved. And now I'm coming to real world data. There were 3 studies not published. The data were released yesterday. One was the Siren study that was done amongst the healthcare workers in the NHS. And there was a study from Scotland, and there was another study. Altogether, 3 studies showed. I'm just giving you the summary. If you take the BioNTech Pfizer vaccine with 2 doses, it is more than 90% effective in preventing somebody becoming sick. And then if it's 1 dose, it's more than 70%. Oxford vaccine, if you have taken 1 dose, it can prevent you becoming sick by 72%. And then if you have taken 2 doses, it will be 94%. So there was a misconception that Oxford vaccine is not going to be as effective as Pfizer-BioNTech, but the real world data shows it is as effective or slightly more effective than the Pfizer vaccine. And then there was a misconception again, and the Europe was concerned that the Oxford vaccine is not going to be effective in the elderly. But now the new data shows it is effective in elderly, and it can prevent severe infection or death in the elderly by about 85%. And another important thing is the UK variant is responsive to the vaccine, so you can prevent infections of the new UK variant. However, there are questions about the South African variant. And there were questions about whether if you are vaccinated, will you be spreading the disease to somebody else? Now the studies show that the vaccines can prevent somebody spreading the infection. And then also there were questions about whether infection itself could be prevented by the vaccine. Yes, there is now data that the infection could be prevented. So overall, all in all these data show that these vaccines are quite effective. And then I would come to the safety of it. And however, you should remember that this virus can easily mutate. Mutations happen if the infection is spreading fast. Mutations also happens fast. Therefore, it's our duty to try and contain the infection. Therefore, we can prevent further mutations coming. And in the future, there may be mutations that are resistant to vaccine. But the good thing is both this Oxford vaccine and the BioNTech vaccine could be tweaked to suit any mutation. So it could be done like, if you take the BioNTech vaccine, they can produce a new one within 2 weeks, and the Oxford can tweak their vaccine within a few months. If you have had the COVID-19 infection, should you still take the vaccine? Yes, because there are mutations. Therefore, you can get another infection after a few months. And when should you get the vaccine? If you have had the infection, you should take it about a month later. You shouldn't be, if you have had the COVID-19 infection, you shouldn't be taking the vaccine within a few weeks. It should be at least 4 weeks later. There are questions about whether it is 1 or 2 doses if you are infected. Some studies show that 1 dose would be enough, but the current guideline is you should still take 2 doses. Are they effective in elderly? I told you it is effective. Can it be used in pregnant people? At the moment, answer is no, because the COVID trials were not done in pregnant people, because you wouldn't recruit a pregnant person into a trial as a volunteer. Therefore, it's not recommended now, but now the studies are going on. And again, during the research trials that were going on with the vaccines, many people became pregnant, and some people became pregnant after the trial was over. So at the moment, it seemed to be safe that no complications are happening in pregnant people, but we are just waiting for more data. And why it is not recommended for people under 16? Again, the same answer. It was not studied. The trials did not include children under 16. But now research is ongoing, so we will get an answer. Therefore, we would not be giving the vaccine for people under 16. And again, another reason why we are not recommending is under 16 are not at risk of severe infection or death. People are worried about ingredients. Can they alter the DNA of you? There are lots of videos and WhatsApp messages. Even some doctors are spreading these messages. I should tell you, in any group of people like doctors, there'll be a few people thinking in a very different way. They will be thinking from like a very small minority will be thinking very, very weirdly. So you would always get some doctors talking against this virus, against this vaccine. And then they can put a lot of videos with lots of lies. So this is another lie. The vaccine, mRNA vaccine, cannot alter the DNA. It's because in your cell, when the vaccine is injected, the mRNA will go in, but it would not go into your nucleus, which is the one contains the DNA. And this mRNA vaccine, the mRNA particles will be destroyed within few hours. So therefore, it cannot alter the DNA. It has been clearly proven. And are there any harmful chemicals? No, there are no harmful chemicals. I've carefully gone through the ingredients of these vaccines. There are no harmful chemicals. Have they got any material from aborted fetal tissues? That was a major issue people were spreading in the social media. There is no fetal tissues used in the vaccine production. And have they got any pork gelatin or fat? No, they haven't got the Oxford or the Pfizer-BioNTech vaccine haven't got any gelatin from pork or pork fat. But I'm not going to talk into the Islamic side of it and haram or halal. I would leave it to the Islamic scholars. But there are clear fatwas from Muslim countries and from the UK bodies that it's halal. And side effects. Anything will have a side effect. If you walk on the road, you can have more side effects than taking a vaccine. If you fly on a flight, you have a small risk of dying, but the vaccine, we haven't seen people dying from direct effect of the vaccine. So did people die of vaccination? No. There were lots of false messages, fake news, fake videos being shared in the social media. And then there was another message saying some 246 people died in the UK after the vaccine. Those are not true. And we are working in the hospitals, and even in my hospital, we have a big vaccination center operating 24 hours a day. So we don't see any major problems. Allergies, I just looked at the American data. They vaccinated 14 million people, and 4.1 case per million allergies were reported. If you eat any food item, say if you give a food item to the whole world, so or 20 million people, you would get allergies more than this. And then the commonest side effects we see is pain in the injection site. Usually you get a bit of pain in the injection site on the next day. You might get headache, feverish feeling, body pains, diarrhea. They are very mild. These are happening because once you are vaccinated, you are developing immunity to the vaccine or the virus. That will develop some sort of feverish feeling, aches and pain, and that is expected, and that happens with any vaccine. So that's the normal phenomena we expect. So it can be different to people. Some people would need few doses of paracetamol or some ibuprofen, but that's not alarming. And then in elderly, these symptoms can be slightly more than the young people, but what they need is some rest and some paracetamol. Generally, hospitalizations were very, very minimal, except in 1 or 2 people. And considerations for women's health and conception, there were news circulating that this will cause problems for your conception. So it's not true. The vaccine does not cause any problem with you conceiving a baby, or even if you conceive a baby after the vaccine. It seemed to be safe. We have had enough cases of pregnancies happening in the trials. So, but we are just waiting for those data. But I can confidently tell you that it does not affect you conceiving a baby or any of your other health systems. And there are lots of other misconceptions. Commonly spoken subject is about Bill Gates, and they are trying to insert some microchips through the vaccine. One thing we should remember is that we are using very, very tiny needles. Through this needle, somebody cannot insert a chip. Even if you have inserted a microchip, you need a scanner to get some data out of it. So somebody has to come and scan your arm to get the data, if somebody could insert a chip. But more than that, I should tell you, even the computer I'm using now is Bill Gates software. So everybody is using Microsoft software. So if Bill Gates wants to track you, he can track you from your computer. He doesn't need to do all these things to get these chips into people. And then you should also know that all your data is just being transmitted every second to Google, Facebook, Microsoft, and all these big companies from your phone and your computer. So they don't need to come behind you to vaccinate you or create a COVID-19 and then get the data. And also you should remember that the government, say the Oxford vaccine is produced by the British government. So another government wouldn't take it if they are going to spy on their people. So it's baseless a myth. And then, is it a Jewish conspiracy? As I said, we always try to put everything to the Jews. But this mRNA vaccine, that's the BioNTech Pfizer vaccine, was developed by a Muslim couple. But if you look at who is used using it. The Israeli government has exclusively purchased the BioNTech vaccine, and they have vaccinated half the population now. So Jews are using the vaccine. If they are doing a conspiracy against Muslims, they shouldn't be using this vaccine. And are GPs paid to promote the vaccine? It's not. The GPs are paid £12.50 for each vaccine, each vaccination. It's because, not to promote it, but they have a lot of cost involved in it. They have to employ people, they have to have places booked, and they have to provide so many things for the staff, and then the bills. So they have to, I think some GPs may be even losing money out of it, but the government will be paying £12.50 for each vaccination because the cost is involved for the GPs. Will you be forced to take the vaccine? No, nobody will be forced to take vaccine, but as a responsible Muslim, you should take the vaccine, because even if you don't get the infection, it is your responsibility to prevent somebody else getting the infection, and you shouldn't be party to somebody's serious problem or a death. And as I told you, if you are young, should you still take the vaccine? Yes. One reason is you should protect others. Two, you can still die, because it doesn't mean that young people are 100% protected. You can still die of it, or you can still become seriously ill. And if you get COVID infection, you can sometimes become seriously ill, and sometimes you can go into long COVID syndrome. Therefore, if you are young and fit, you should not refuse vaccine. I should tell you here, for the whole country, we need at least about 70% people vaccinated to produce something called herd immunity. That's how we control the epidemic. So at least 70% should take. And then I saw a video circulating, a Muslim brother talking about CDC says 3,000 people were permanently affected. And he also said 3% of people experiencing side effects. That's all not true. He just misinterpreted the CDC website information. Sometimes these medical informations can be easily misinterpreted by non-medical people. Will COVID infection cause the infection? No, there were people were spreading messages that if you vaccinate, sometimes you can get the infection from the vaccine itself. It's not true. If you are vaccinated, will your PCR or the lateral flow test will become positive? No, it wouldn't become positive. After vaccination, your test wouldn't become positive. However, one thing you should remember is, like, after the first dose of the vaccine, you can still get the infection. Your PCR can become positive, or lateral flow test can become positive, but the symptoms will be very, very minimal. The risk of you becoming very ill is very low, but you can still get infection after the first dose. After the second dose, your infection risk become very, very low, but still very small percentage of people can still get infection. That doesn't mean that this vaccine is 100% effective. No vaccine or no treatment will be 100% effective. However, it is now we are getting data that it is about 90 to 94% effective. That's one of the best data we are getting for a vaccine. And this is one of the WhatsApp messages circulating. I just wanted to show this. This says UK government releases shocking report on COVID vaccine side effects. It's a fake message. There are such a lot of fake messages. It's overriding the true news and the true data. Therefore, my very kind request is, don't rely on information coming from WhatsApp, Facebook, and the YouTube. The information you are getting are mostly fake news. Most of these videos are paid and promoted. Therefore, these fake news will come to the front of it, and the true news will be hidden behind. Therefore, don't rely on them. Please don't share them. By sharing them, you are doing big harm to the society, to the whole world. Thank you. We will then end of this session, we will go for discussions if you have any questions.
Jazakallah khair, Dr. Kamal. Very comprehensive presentation, mashallah, and I think you've answered many questions, so Jazakallah khair. We are running slightly behind schedule, so I propose that we slightly drop the Q&A time, but without further ado, I'm going to hand over to Sheikh Yunus Dudwala, Head of Chaplaincy at Barts NHS Trust, inshallah.
Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. والصلاة والسلام على سيد الأنبياء والمرسلين وعلى آله وصحبه أجمعين. أما بعد فأعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. لقد خلقنا الإنسان في أحسن التقويم. صدق الله العظيم. Respected brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah to SLMCC for inviting me here today to just speak very briefly about the vaccines from an Islamic perspective. I thank Dr. Kamal. I think his presentation has covered most of everything that I was going to say anyway. There's not much for me to say. So inshallah, there will be time for question and answers. I'm just going to speak very briefly, inshallah. I think from an Islamic perspective, we need to look at whether, as Dr. Kamal mentioned, is there really a pandemic? I mean, majority of those people who I liaise with and who are in touch with me, and they are very skeptical about the vaccine, there's usually something else behind this skepticism, because not only are they skeptic about the vaccine, they don't believe in the pandemic. They just don't believe there is a pandemic. And some of us who work in the hospitals, we know what we've been through for the past year. I was working in the Nightingale Hospital in the Excel, and I've been working in Newham Hospital, Royal London Hospital, especially in the second wave, the Royal London Hospital, which created two floors of critical care beds. Over 170 beds were created, ICU, extra. During the first wave, they were built in that 2 floors. And that's why we didn't have to open the Nightingale in East London, because all these patients were being taken to the Royal London Hospital. And at one time, I can say there was about 200 patients who were on a ventilator in all our hospitals, 4 hospitals. It was like a war zone. So for some people to pretend, and then you see these videos being sent around, which pretend to show that the hospitals are empty. We had 2-3 videos just at the end of December, beginning of January, where people were sending a video from Gloucester, people were sending a video from Croydon saying, oh, there's nothing in the hospitals. Ya Allah. So I think these individuals who are skeptical about the vaccine, there's something behind that as well. And that is that they believe that there is nothing, there is no pandemic going on. And those people who have lost loved ones, it is an insult to them. It is an insult to them to even suggest that there is no pandemic or there is no virus, etc., etc. In terms of the numbers of people who have died, there's over 120,000 who have died in this country, more than 500,000 who have died in America, over 2 million people around the world. Some people will say, well, it's not a big number compared to the number, but it's not only about the number of people who have died. Look at the measures that have been brought in, and yet so many people have died. Look at how much the hospitals have been busy and overwhelmed because of this virus. And if it wasn't for this lockdown, the hospitals would not be able to cope. So we need to take things holistically, and we need to understand this pandemic and this virus holistically. Going on to the vaccine itself. So are we allowed to take vaccines or not in normal circumstances? Is there anything that prohibits us from taking a vaccine? So yes, it is not farad for you to take any medicine, unless it is a life-saving medicine and you know for 100% that that is going to save you. So it's not farad, it's not compulsory. However, if you know that by taking something it will protect you, then it's recommended that you should take it. It is recommended that you should take something, especially not only is it protecting you, It's protection for your family, it's protection for the community, it's protection for society. So if there is a vaccine, which is a preventative measure, and we know that it protects us, it protects our community, and it protects our society from getting seriously ill and from overwhelming the hospitals, then it's recommended that we should take it. What do the ulama look at? They look at the ingredients, they look at the manufacturing process, they look at whether it is going to be beneficial, they look at the efficacy data, they look at the trial data, and then they will say, yes, so looking at the ingredients, alhamdulillah, there is nothing wrong in the 2 vaccines that have been approved in the UK. The muftis in this country have looked at it, the muftis in Australia have looked at it, the muftis in South Africa have looked at it, the muftis in America have looked at it, and muftis around the world have looked at it, and there are no ingredients within and no manufacturing process which is prohibited that will make these vaccines haram, and therefore these vaccines are permissible. So these vaccines are permissible. Now, who do we ask whether there is an issue with the vaccines? Do we ask somebody on WhatsApp? Do we ask somebody who has been skeptic about everything about the virus? Or do we ask the experts who are virologists, immunologists, and infection control specialists? So what I did myself as an imam, I spoke to consultant virologist in Barts Health NHS Trust. I spoke to a Muslim friend of mine who is a PhD in infection control who works in Saudi at the moment. He used to work here. And I have a lot of trust in him because he's an infection control specialist PhD. And I've spoken to immunologists. And all of them have said that this virus does not change your DNA. This virus is not harmful. This virus will hopefully protect us. But in terms of harm, there is nothing which is there that is harmful. And all these videos from YouTube and WhatsApp, which some of our community, unfortunately, keep on passing around, and they are full of misinformation. It is harmful to our community. And, you know, when I ask somebody who sends me sometimes these videos, Maulana, you know, look at what this person is saying, you know, we need to think about what we're really taking in the vaccine. So the first question I ask that person is that, who is the speaker? Who is the speaker? And Dr. Kamal mentioned that there's this Muslim person who's been saying things about the CDC data, etc., etc. I asked 10 people, who is the speaker? And they don't know his name. And yet they trust him. Why? Because he says, Subhanallah, Alhamdulillah, Allahu Akbar. And he says he has a beard and he looks religious, and therefore you have to trust him on vaccines. Is he an immunologist? Is he a virologist? Does he have any infection control background? Nobody knows. But because he says, Subhanallah, Alhamdulillah, Allahu Akbar, it's fine. Ya Allah. Is this what our deen is about? Our deen has principles. Our deen, when we look at our deen and our religion, it was always verify information. Verify information. This is why our Hadith studies and the whole Hadith books that we have, whether it's Bukhari, Muslim, are based upon verification of the people who have narrated the Hadith. Why is Imam Bukhari's book considered the most authentic book after the Quran? Because he was very strict on the conditions that before he used to take from any narrator. And today we've left that principle and we go and ask any person who's called Muhammad or Abdul or John or Tim, as long as they've got a good YouTube channel and good following, we will follow him. Astaghfirullah. This is not our principle. You go and ask the experts. فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Go and ask those with knowledge if you do not know. Yeah. So in the field of when somebody has a heart problem, they go to the GP, and the GP then refers them to the heart specialist in the hospital. When somebody's having headaches, constant headaches, the GP refers them to the neurologist. The GP is a doctor, but he sends them to the specialist. When somebody has kidney problems, he sends them to the hospital, to the kidney specialist. And we go to them and we speak to them and we trust them. We don't go to YouTube. We don't go to WhatsApp. When we take tablets, we've never scrutinized our tablets that we take to the level that we have scrutinized this vaccine. Those who are skeptical of the vaccine. We've taken heart tablets, we've taken blood pressure tablets, we've taken kidney tablets, we've taken every other tablet in the world for our conditions, but nobody's ever said, what's the efficacy? How long was it tested? Nobody's ever looked into it. But this vaccine, we've become so concerned about this vaccine and all this changing DNA and all these rumors that have been spread. Why? Because of that first rumor, the first point, that people don't even believe that there is a virus. So the problem is not really the vaccine, in my opinion. The problem is the belief that those people who don't believe, majority of those, there are some who are hesitant. And as Dr. Kamal mentioned, people are hesitant because they say, well, it wasn't tested for so long. But as Dr. Kamal mentioned, there's a reason why these vaccines have been produced so quickly, because the whole world came together. The money came very quickly. And we had vaccines for SARS previously that helped us develop these vaccines. And if there was any doubt previously that, oh, there wasn't enough trials, there was only 40,000 people in the trials, etc., now those who are skeptical or those who are hesitant because of the number of people who might not have been tested, then now 210 million doses of vaccine have been given. 210 million shots of the vaccine have been given throughout the world. And as Dr. Kamal mentioned, majority are in Israel. Yeah, nearly, how much percentage of their population? Do you see all of Israel, 50% of the population who has died yet? Do you see out of 210 million people, if, as some people have gone around and said, it's poison, it's poison. I heard one mufti from South Africa who mentioned it's poison, it's poison. If it's poison, if there's 10 people who drink poison, how many would survive? And here you've got 210 million people taking shots, or 210 shots being given, and there's no deaths. There's no deaths. Or, people are not dropping sick as if poison has been given in their bodies. So, we need to really get back to our principles. Ask the experts. Be careful where you take your knowledge from. Yeah, because our deen is based on principles of realizing where we take our knowledge from, and being very careful on where we take our knowledge from. And the last point I'd like to mention is the hadith of the Prophet ﷺ, that it is enough for a person to become a liar if he was to say everything that he heard. And in this day and age, if he was to forward everything that came to him, a video comes, you forward, whether it's verified or not verified. A message comes about anything not verified, forward. It is enough for you to become a liar if you keep on forwarding everything. The hadith of the Prophet ﷺ. So when it came to my turn to take the vaccine, over 6-7 weeks ago, I took the vaccine. And I made a video and I said at the time that I've asked the experts. And we know that there's no haram ingredients. We've asked the experts and they've said it's safe. And now the reports yesterday in the trials, in the NHS staff, the live data that's coming out of Israel shows that 90% of people, it's being effective. The vaccine has been effective in 90% of people, as Dr. Kamal mentioned. So we really need to think about protecting ourselves, protecting our loved ones, protecting our community. This is an Islamic responsibility of protection. Whether you take it or not is your choice. Nobody is going to say it's farad, but it's definitely recommended. And we should think about the protection of ourselves, our loved ones, our community, our society, and we should try and help the community, the locality, the country to get back to some form of normality. Assalamu alaikum wa rahmatullah.
Jazakallah khair, Sheikh Yunus, for that very important reminder, particularly on verifying information, something that we can all definitely take into account, inshallah. So now for the next 15 minutes or so, we're going to briefly discuss the actual vaccines rollout locally. So firstly, we're going to hear from Dr. Nizar Merali from GP Direct in Harrow, inshallah, who's going to talk a bit more about this topic.
Assalamu alaikum, everybody. Can you hear me okay?
Yes, we can hear you, yes.
Okay. So thank you very much for inviting me to say a few words. Although I logged in to hear Dr. Kamal Nasser and Sheikh Yunus Dudwala, I'm afraid I wasn't giving my full attention because simultaneously I was in another meeting, the Harrow Council meeting, Health and Social Services Scrutiny meeting that I sit in. And so I got some information fresh from that meeting to pass to you as well. So Alhamdulillah, as you know, brothers and sisters, in Harrow, we managed to start the vaccine program pretty early on. In fact, we started before Christmas, and I was lucky enough myself to actually been offered my first vaccine in the very first week that the program started. And luckily, just because of that, and it's just time factor, I managed to get my second COVID vaccine as well in the first week of January. I know the government guidelines then were introduced that we would rather vaccinate larger numbers with the first vaccine than give the second vaccine. And as we heard Dr. Kamal Nasser, that the first vaccine gives a significant protection. So I think we should be fairly relaxed about that even if you've had the first vaccine, you are reasonably well covered. Incidentally, I've just heard just now that the second vaccine rollout will begin first week of March. So first week of March, people who have had their first vaccine towards the end of December will begin to be invited, inshallah. And that then boosts your immunity up to 90%, as you heard earlier. So needless to say, I keep on encouraging everybody, let's please have the vaccine. It is a savior. I'll come back to that in a moment, taking it from a different angle. As far as Harrow is concerned, compared to, say, Northwest London or the whole of London, Harrow's figures are better in terms of vaccine uptake. Look at the age 80 plus, for example. Harrow has had 88% of its population vaccinated, 88%, whereas Northwest London has managed 81%. By the way, outside London, there are areas which have managed 90% plus. And if you look at the other age groups below 80, it's similar performance that Harrow is ahead of almost all the London boroughs. So we should really be patting ourselves for that, and full marks to the whole team from the local authority, the Harrow Council, from the CCG, the Harrow Health Body, the general practice practices, the general practice provider federation called the Harrow Health Limited, and everybody else who has really worked hard. Harrow today has got 3 vaccination centers, as you all know. The first one that was started was at the Hive in the eastern side of Harrow, and then we've got 2 more centers established in January and early February. One at Byron Hall at Harrow Weald, and the Tithe Farm Club in South Harrow. So today, anybody can log on to the website, and if they're eligible, they can book themselves for the vaccine, or they can ring a specific number which I haven't got handy to book. But normally we are asking people not necessarily to book yourselves, let your practices book it. And the practices have actually devolved that responsibility to Harrow Health Limited, who are actually contacting the eligible groups. I'm not sure whether the eligible groups were mentioned earlier, but as you know, we have done the first group, which was the health and social care personnel or staff. Then we have done the second group, which was the 80 plus. We have done the third group, which was 75 plus. We have done the fourth group, which was 70 plus, plus all the shielded patients or patients who are extremely, clinically extremely vulnerable. Now we are working on nationally, as you know, group 5, which is age 65 plus, and group 6, which are essentially people who are at high risk. And this group of people, age 16 to 65, are essentially the same group of people who were invited to have their flu vaccinations. So everybody who annually gets invited for the flu vaccination, everybody in that group are now eligible for their COVID vaccinations as well. They've just tightened up one or two criteria. So, for example, for asthmatics, rather than all asthmatics, there are some asthmatics who are particularly brittle. Asthmatics, those who have had hospital admissions in the last 12 months, or those who have had repeated oral steroid tablets. But otherwise, the rest of the groups, whether it's COPD, the diabetics, and the others, everyone who is vulnerable, or everybody who's at risk between the age of 16 and 65 will be invited to have their vaccination. I won't go into the details of the vaccination itself because I think Dr. Nasser, I saw the slides and that has covered them very well. Let's look at the cases. I mean, I think you'll all agree, and you're all listening to the news and the national figures, that the vaccination program has really been what has come to our rescue in terms of, as you see, the number of cases. In January, for example, in Harrow, there were 1,000 cases per 100,000. So Harrow has got a population of 250,000. So there were 2,500 weekly cases, 2,500 cases every week in Harrow in January. Until the 14th of February, the week, 7 days up to 14th of February, that figure from 1,000 had come down to 328. Until 7 days up to the 18th of February, it had come down to 263. And fresh off the news, just heard 1 hour ago, 7 days up to today, it has come down to 130, alhamdulillah. In terms of new cases on a daily basis, nationally, there are 8,000, again, this is today's figures, 8,500 cases, new cases daily throughout the United Kingdom. And if you extrapolate that to Harrow, 60 million United Kingdom's population, 250,000 Harrow population, then Harrow should have about 35 new cases every day. But actually Harrow has got 50 new cases every day at the moment. But I think that some of this is relating to the to some of the vulnerabilities, if you like, within metropolitan London. Of all the age groups, those who are passing the infection most are the age groups 25 to 59. These are the people who go out and work. And the ages 18 to 24. These are the students and the early job seekers. So 18 to 59, if you like, are the group of people who are passing the infection most within the community. If you look at Harrow and its ethnicity, we all know nationally, we all know these figures that the BAME, the Black and ethnic minority groups have got a higher incidence of vulnerability to this illness, and in terms of deaths as well and hospital admissions, these groups are more affected. In Harrow, by the way, just like nationally, the number of patients in hospital hasn't dropped yet significantly. Today, there are 17,000 patients in hospital nationally. Northwick Park ITU particularly is full with patients. But I think the number of patients who are becoming more unwell and number of patients who are dying is getting lesser for several reasons, including the fact that the treatment has been learned over the last 12 months, and there are defined protocols of treatment in the hospital. I just want to end by encouraging our brothers and sisters, for those who are still hesitant in having their having their COVID vaccination, to please seriously consider it, as the Sheikh and the Imam said, that it is our duty. It is our duty to protect ourselves and protect the community as well. We had always heard from day one that if there's a 60% herd immunity, or if within a community, if 60% are vaccinated or have got antibodies in their blood, if you like, then that is a more protected community, so to speak. So nationally, today, we are, I think, nearly at 18 million people who have been vaccinated. There are 4 million more people who have had natural COVID illness. So that brings you to about 22 million people who have now been vaccinated. So 22 million people who now have COVID antibodies in their blood. And if you compare that to the population, adult population of UK, say from age 16 upwards, of about 50 million, that is nearly 44% of the community is now have got immunity or antibodies in their blood. So we have to keep on working on that to push it up. I said this last week when we had the Tamil program, that best way is to consider the flu vaccine. When the flu vaccine was introduced, whenever it was 20 plus years ago, and I remember these vaccines, yes, were not that pure, were not that effective, and many people were not having it, including myself. I wasn't having it. But in the last 10 years, the flu vaccines have become more refined, more purer, and less side effects. In fact, hardly any side effect. And there's more and more take up in the community. So I have started having my own flu vaccine every year for the last 10 years. In fact, as I said last week, even during Hajj, when I used to accompany a group for 10, 12 consecutive years, particularly when Hajj fell September, October, November, December, I used to encourage the Hajjis to have flu vaccination. And believe me, it did make a difference. So on the same basis, the COVID vaccination, just one other point for the flu vaccination. In 1918, believe me or not, there were 50 million to 100 million people globally who died of flu. Okay, and UK had about 150,000 of those who died of flu. Today in United Kingdom, some 8,000 to 10,000 people die every year of flu. Compare that with 100,000 plus of COVID in the last 12 months. So just like flu deaths having come down, there is a distinct possibility that COVID deaths will come down significantly, particularly as more and more people get immunized. And I wouldn't be surprised, and Dr. Nasser might agree with me, that you might need a regular booster of the COVID vaccination, maybe once a year for a couple of years at least. I just like to finish by putting one myth, which I'm sure Dr. Nasser has covered, that many people say, how can you produce a COVID vaccination within 4 months, 5 months? All these other vaccinations have taken years to develop. There must be something nasty about this. There must be some conspiracy about this, of having produced it so quickly. My answer to this is quite simply what I heard from an eminent virologist. Just imagine that you decide just now to travel from your house here in Harrow to drive down to Central Harrow in a normal non-COVID period, yeah, in a normal road. You will come across the traffic, you'll come across the traffic lights, you'll come across lots of other obstacles, but you'll finally reach your central central London destination. Now imagine that you're given a very fast car, you're given a police escort, you're guaranteed that all the traffic lights will be green, and you're told that there'll be no traffic on the road. And you're to go the same road to London. Do you all agree that you'll reach there much faster? And that's exactly what happened with this COVID vaccination development, that every resource was put in, no money was spared, people worked 24/7 to produce it. So none of the processes in terms of testing to make sure that they're safe, to go through all the stages of development, none of them were compromised. It is just the speed was there because they were given the full resource. Brothers and sisters, it's a safe vaccine. The sooner you have it, the earlier. And if there's any help that you need, I don't mind you talking to me. This afternoon, once I was in surgery, I had to ring one of my patients who was 77. And she and her husband, she said, look, doc, I have not been out of my house from the 8th of March last year up to now. Not at all. I haven't been out of my front door. And I'm even worried about going to one of these 3 COVID centers to have my vaccination. So she started asking me, which is the largest of the COVID vaccination centers, which is more spacious so that I don't catch COVID from anybody else. So I told her, look, there is a service now available for vaccinators to be able to come to your house if need be. So that's what the service level is in Harrow today. Thank you very much. Assalamu alaikum.
Wa alaikum assalam. Jazakallah khair, Dr. Nizar, for that very comprehensive overview of the local rollout. So I'm just going to hand over now to Dr. Azza Al-Naim, just to give, as a Harrow CCG representative, to give a very quick picture of the local rollout as well, in addition to Dr. Nizar's presentation. Then we'll move on to Q&A, inshallah.
Hello, can you hear me?
Yes, we can hear you.
Okay, brilliant. Assalamu alaikum, everybody. My name is Dr. Azza Al-Naim. If you just bear with me 1 second, I'm just going to share my screen just to get my slides up. And if someone could just say yes when they see it, that would be great. Just going to go to presentation mode. Oh, it's gone too far. Please bear with me. Always a little bit of tech problems. All good?
We can't see your screen yet.
Okay. It just says I'm screen sharing, bear with me. And how about now? Anything at all? I'm happy to do it without. Oh,
we can see it, yeah.
Lovely, okay. Assalamu alaikum, everybody. My name is Dr. Azza Naim. I'm a medical doctor by background, but I'm currently on the public health medicine training pathway. So I'm here representing Harrow Council. I should say I'm not South Asian by background. I'm actually from Sudan, but it's a very similar community with very similar risk groups to the South Asian community, being Black and being Muslim. So just like to thank all of our previous speakers as well. I thought they were brilliant, very clear, very interesting. And I do apologize, there might be some duplication between me and Dr. Murali, but I'll try and whiz through those slides where there was kind of duplication of information. But I'm glad to see it's consistent for both of us. Now, just to give you a brief update about the current COVID-19 situation in Harrow, I'd really like to echo the sentiments of the previous speakers who were saying that, you know, some people think that this isn't real, that this is a hoax, and that's just patently untrue based on the experiences both of the doctors here and the experiences of all these other frontline workers. At the moment in Harrow, unfortunately, cases do remain at high levels. We are still seeing 40% more new cases per day than we saw back in November, so back before we went on that really brief, short lockdown. Although thankfully the numbers are decreasing compared to January, where we had that huge surge of the second wave. There are still high numbers of people in hospitals, particularly in Northwick Park, and particularly in ITU levels. And as a result of this, we are still seeing deaths, and deaths are increasing. Now, this is an expected lag. As cases go up, eventually hospitalizations and deaths follow. However, given the vaccine rollout and the current lockdown measures, we are expecting deaths to follow the trend for decreasing cases. So that is positive news on the horizon, although it is some time away. And as Dr. Murali said, we are testing positive across all age groups, even though this is mostly concentrated in people of working age. Our high-risk groups, such as those over 80, are also still testing positive at a greater rate than the borough average. And this is really the group that we are hoping to protect and encourage and really push to get their vaccines. And actually, we're doing quite well in doing that. Just to give a brief overview of our uptake figures, again, these are very similar to those previously discussed. We have our 3 hub sites, so that's Byron Hall, the Tithe and the Tithe Farm and the Hive, all running up by our primary care network partners who are doing brilliantly and doing a lot of the legwork. We are also getting these roving teams, just as Dr. Mariah said, who can go to housebound individuals, people who can't leave their house for whatever reason, to give them the vaccines. And we are considering producing same-day access sites as well. So for individuals who are perhaps a little bit nervous about going to see their GP, a setting where they think there might be more or other ill people, we are considering trying to roll out some same-day booking access sites. I know in East London as well, the East London Mosque had a pop-up site that was very successful in Tower Hamlets. This is something that we would like to replicate. Logistically, this takes a little while to set up, so I can't say that that's in the works just yet. But it is something that we are seeing other boroughs in London do, and something that we think is completely feasible, perhaps in Harrow over the next few weeks. Generally, we are on track and we are doing really well. We've now started kind of moving on from our slightly older patients to those who are clinically extremely vulnerable, so lower down in those priority groups. And as of today, we've vaccinated with at least the first dose 88% of our 80-year-olds, 93% of our 75 to 79-year-olds, and 91% of our 70 to 74-year-olds. Now, we are doing a lot better than our kind of other Northwest London borough counterparts, but on the whole, London is slightly lagging behind, and there have been questions raised as to whether that was linked to the fact that we have a higher proportion of Black and ethnic minority groups. We are kind of more likely to have houses of multiple occupancy. There's a lot of increased risk factors, including inequality here in London. So it is really important for us to address these, not only in kind of managing COVID, but also in our targeting of the vaccine campaign as well. For us at Harrow Council, I think our key messages are around how can we help with vaccine hesitancy and vaccine confidence. It's really important to say that it's understandable and normal to be hesitant about getting a vaccine. All of us have a visceral reaction to taking any medication, whether it's a medication you've never taken before or something that you've taken for a long time. And for some communities, particularly our communities, there is a historical mistrust of some of these organizations based on what we've seen happening in our own countries back home, based on what we've heard from other people in different parts of the world. We do know that their vaccines have been politicized, they have been used for different purposes, but the question is, what is it about this vaccine that makes us believe in it? What can we do to help dispel any myths, and what can we do to minimize concerns and fears? I think Dr. Nasser very kindly went over a lot of the myths and helped debunk a lot of the things that we see circulating around on WhatsApp these days and on YouTube. But it's important to say that just because you've seen these videos and you've believed them, it doesn't make you stupid, it doesn't make you gullible, it doesn't make you someone who's easily manipulated. They are designed purposefully to try and get into people's lives. They're socially engineered to be believable, and I think it's important for us to recognize that just because they exist doesn't mean that we can't change our minds. It doesn't mean that we can't actually ultimately find the truth and work forward as a community. So it is understandable, but hopefully we are here to help, and today's a start for that. If offered it, please get the vaccine. I mean, I know everyone has said it, but we do have to reiterate it. Getting the vaccine is not only going to protect you against severe disease, it will protect you against the risk of death, and it will protect you against that risk of long COVID. 1 in 20 people, according to the latest ONS COVID-19 survey that looks at kind of random infection across the country, picking out a random sample to see how many people have it, 1 in 20 people was still having symptoms following the 5-week mark. And that is a pretty significant number. You know, you might think that you're young, you're fit, you'll bounce back, nothing will happen to you, but that is not always the case. And even if you don't end up being a person that goes to hospital or to ITU, you should want to protect yourself against potentially, you know, debilitating long-term symptoms, including brain fog, memory problems, nerve problems. To this day, some people are still struggling to exercise and get back to the gym, obviously when gyms open, but, you know, get back to lifting weights like they want to, running out like they want to. So it is important to raise that point as well. Lastly, as we've just recently discussed, these new studies that have come out in the last week have showed that we can reduce transmission through the vaccination program. So when you are getting this vaccine, you are also doing it to protect others. And from a public health perspective, going beyond the herd immunity conversation, it's important for us to have a high level of coverage, a high level of people taking up this vaccine, because that reduces the chances of mutations of the vaccine, reduces the chances of new strains being created. When you have high levels of virus circulating in the population for a really long time, you're increasing the chances that a new strain will come out. So the sooner we all get to that high level of coverage, the less likely we will see a mutation, and the sooner things like international travel come back onto the agenda as well. So it is important for us to look at it, not just for ourselves, but for everyone else. And really important not to forget that there are very, very few, you know, small amount of people who can't get the vaccine as well, for whatever reason, for specific medical reasons, who are unable to have it. And it is our duty, I would say it's our religious duty, you know, just to keep this kind of secular from Harrow Council, but as a Muslim myself, you know, it is our moral duty to protect other people, not just ourselves. So we should take that into account as well. And please don't forget that you still need to socially distance even after getting your vaccine. Although we do know that there is an element of reduced transmission now with the vaccine, so kind of you're less likely to give it to somebody else, we don't know the full extent of that yet. And although these vaccines do work, they do not offer exactly 100% protection. Not everything is 100%. So it's important that we keep ourselves on the right side of the statistics. So by other things, kind of, you know, non-vaccine related measures. So socially distancing, washing your hands, please don't forget. Some key messages around communication I think we'd just like to emphasize are, do talk to your loved ones about their trusted information. You do have a key role to play to uphold community trust and community spirits. And I think there's only so far doctors and nurses and physios can go. I think we all have a role to play in checking ourselves and saying, oh, actually, where did you get that information from? Could you show me the source for it? Where is the link for that? Don't be afraid to question loved ones, and don't be afraid to question all sources. It is important to be skeptical, but it's also important to know who to trust and when to trust them. Don't forget to share your vaccine stories more widely. We'd really appreciate it if you do get vaccinated. Do give us a shout out on Twitter at Harrow Council. Do share your photos in, you know, with your loved ones on your family WhatsApp groups. Make sure that you are sharing your positive experiences as well, just to see if your story is connecting with others and to remind people that actually it is safe. And here are just some tips and tricks to become good fact checkers. If you don't know who created information and you can't trace it back to a source, you really have to stop and think, could this be fake? And if you're unsure, double check with a trusted source. Sometimes that's your 14-year-old son saying, hey, does this look fake? Are there any spelling mistakes? Does this look like, you know, a phishing email, a scam email? And sometimes that's checking with your GP. You know, I should say that both my parents are doctors and they still come to me as their daughter to say, hey, let's just double check, because I do a different specialty than them. My father is a surgeon and still has to say, okay, let me just see if this WhatsApp message is right. Interpretation is not always simple. Unfortunately, the science behind vaccines is complex, and we all need support, whether we are educated or not, whether we are, you know, whether we have PhDs in virology or not. I think it is important for all of us to think, actually, who can I speak to get help for this? And don't forget, as always, although WhatsApp and YouTube are brilliant for communication, they are easily manipulated. So if you are getting sources from WhatsApp and YouTube, I would really implore you to use a really high level of discernment when using those particular platforms. feedback your own experience back to us, please, both good and bad. We are all learning here. It's been, you know, a long time since the UK launched a national strategy in a kind of pandemic type setting. So even if you have a good experience, do let your GPs know, do let the vaccination hubs know. It's important for us to stay motivated, get morale up. And if you do have a negative experience, as long as it's constructive, there is no harm in constructive critique. So you can pass that back to general practice or to us, and harness this knowledge and keep this skills up. The fact that you guys are here is brilliant. It shows that you're informed and you want to be empowered. And these are wonderful public health skills for everything else that you can take with you. Unfortunately, we can't predict, you know, the whole course of a pandemic, but should we see small outbreaks in the future of anything else, this will serve us right. So learn the skills you've had now, whether they're hand washing, whether they're being good at fact checking, and keep them up. And just because, you know, from a Higher Council perspective, I have to talk about testing, please do get tested if you are symptomatic. Don't forget that you can do a home testing kit or go in person to a testing site. Consider a free lateral flow test if you have no symptoms. We have 5 testing sites that currently do this in Harrow. Self-isolate if you are symptomatic or if you've tested positive. There are some wonderful resources on our website. I've put the link there. These resources include how to get financial help if you are a low-income household, as well as well-being support and support to help you deal with any other issues at all, whether they are domestic violence, whether you just want some exercises to do at home, whether you want to access the library remotely. These are things that we have available, so they are there. Please do have a look at them, and they are all free. And again, continue to socially distance and wash your hands, even if you are self-isolating following a positive test. These are just good practice hygiene habits to take with you. And lastly, just a list of further information. Please don't forget to kind of have a look around on our website, but I should note that tomorrow we do have another COVID community webinar at 6:30. So if you are keen to bring somebody else along, or you want to cover some of the things we've covered today, we have that happening tomorrow. And here are just some examples of other websites or other organizations that probably have some good quality FAQ sections, frequently answered questions sections, that you can have a look at just to update you of everything we've talked about today. So I will leave it there. Apologies, I think I might have ran slightly over my time, but happy to take any questions as well. And thank you to our speakers.
Jazakallah khair, Dr. Azhar. Thank you very much. And great to see that Harrow in particular is doing quite well with the rollout compared to other Northwest boroughs. So Jazakallah khair for all of that information as well. So I'm aware that we've slightly run over time, so we'll have a very, very brief Q&A session. One question we have had already, and Sheikh Yunus, this is one that you could potentially answer, is about fasting and having a vaccine. Is it permissible to have the vaccine while you are fasting in anticipation of Ramadan?
Yeah, Bismillah ar-Rahman ar-Rahim. There's nothing wrong in having a vaccine whilst you're fasting. There are some opinions about whether you take nutritional vaccine and whether that breaks the fast. That's a difference of opinion in that particular vaccine. But in taking this vaccine, it will not have any effect on the fasting. However, obviously, if you do get sick afterwards, then you just apply the laws of fasting of when you get sick. So if you get so sick that you can't continue your fast, then you break your fast. And if you can continue, then continue your fast. And if you do break your fast, then you make up for it afterwards.
Okay, Jazakallah khair. Very, very concise. Anybody, I guess the floor is open to attendees if there are any questions. So we have a question from Farah. Farah, can you please let us know your question? Farah Kiani, I think you may be on mute.
Assalamu alaikum.
Alaikum salam.
Jazakallah khair for a very informative thing. Now, my question is, I am going to have my vaccine inshallah on Friday. I have this nagging feeling within me. I want to keep my tawakkul. What do I do? You know, people keep on telling me, tie your camel, and you know.
Yeah.
What's the advice?
I'll take that answer. So, there is a hadith of the Prophet ﷺ where Prophet ﷺ says, tie your camel and then have reliance on Allah subhanahu wa ta'ala. Reliance in Allah subhanahu wa ta'ala, we must never ever forget that we believe that everything that happens through the will of Allah subhanahu wa ta'ala. Okay, the virus, the illness, the death, everything happens through the will of Allah subhanahu wa ta'ala. So our tawheed in Allah subhanahu wa ta'ala and our belief in Allah subhanahu wa ta'ala should not be affected by this virus. Okay, that's number one. However, we live in a world of means, and everything that we do around here, we have to do, and there are means that get to the objective. So for example, if a person sits at home and says, Allah subhanahu wa ta'ala will grant me the wealth, Allah subhanahu wa ta'ala will grant me the sustenance, Allah subhanahu wa ta'ala will grant me the food, Allah subhanahu wa ta'ala will give me everything, that's not going to happen. We have to make an effort to go and earn some money and then go and buy some food and then cook it and then eat it. Similarly, when it comes to illness and protection, we have to take whatever protection we have around here and then rely on Allah subhanahu wa ta'ala. So we eat and then we rely on Allah subhanahu wa ta'ala to give us strength to do the ibadah and to do the work, etc., etc. Similarly, the vaccine is a means of protection. It doesn't guarantee protection. Only Allah subhanahu wa ta'ala will make the vaccine give us protection. There will be some people who will take the vaccine and they might die a month later, 2 months later. That's the qadr of Allah subhanahu wa ta'ala. It's not because of the vaccine, it is the qadr of Allah. Okay. Similarly, and I always say this to people who are in hospital, that you can have a person who's healthy and is okay, he's gone to the hospital for a minor thing, and then suddenly he has a heart attack. There's 100 doctors around him, but they can't save him. And there's somebody else walking on the street and he's got nobody around him, he has a heart attack, and then after half an hour somebody comes and they are able to save him. This is the qadr of Allah. So we have to take the means and then rely on Allah subhanahu wa ta'ala. This is our deen, and it's always been our deen.
Jazakallah khair, Sheikh Yunus. I hope, Sister Farah, that answered your question.
Sorry, just to add, the
Yep.
Prophet ﷺ said, Tadawaw ya ibadallah, take medicine, O servants of Allah. Take medicine. فَإِنَّ لِكُلِّ دَاءٍ دَوَاءٍ, because in every illness, for every illness, there is a medicine, there is a cure. Now, if we were to rely on Allah subhanahu wa ta'ala, the Prophet ﷺ would have said, only rely on Allah, don't take medicine, don't take nothing. Prophet ﷺ himself took medicine. Prophet ﷺ himself did hijama, and he took hijama as a preventative measure. It wasn't because that he had some illness there that he had to remove. No, it was a preventative measure. So vaccines can be similar as a preventative measure so that we don't catch the illness.
Jazakallah khair, Sheikh Yunus, and Jazakallah khair, Sister Farah, for the question as well. Anybody else have any other questions? Please raise your hand if there are any other questions related to the vaccines or the program itself, locally and nationally. I think perhaps all the presenters have covered all of their questions that may have had. We have a hand up. Can you please introduce yourself and ask your question?
Assalamu alaikum. Thank you so much for the talk so far. I just have heard quite a lot about vitamin D, taking high levels of vitamin D. I would like somebody to address that. Is that something we should be just doing just as a not preventive, but just something, a healthy thing that we could do and take on board?
Sure, Jazakallah khair. Dr. Kamal, was that something you could answer? Yep.
Yeah, vitamin D, lots of Muslims are vitamin D deficient. Even I come from Sri Lanka. I have done studies in Sri Lanka. About 85% of Muslim females were deficient in spite of good sunny weather. So it's because of our dress and so many factors. Vitamin D is not a treatment for COVID-19, but any viral infection can be prevented by taking vitamin D. Vitamin D has a preventive side, but not as a treatment. If you are vitamin D deficient, taking vitamin D about 1,000 units daily would be useful as a preventative measure for most of the infections. But it doesn't mean that you wouldn't get infection or you wouldn't get COVID-19. But if you are deficient of vitamin D, you are more likely to catch an infection. That means it's the vitamin D can boost your immunity. So 1,000 units once a day would be useful for most people living in the UK.
Jazakallah khair, Dr. Kamal. I hope that answered your question, sister.
Yes, thank you so much.
Okay, barakallahu feek. I'm
Jazakallah.
conscious of time, so we'll have maybe one more question if anybody has any further questions that they would like to ask our panel. Any final question for our panelists? Okay, I think we've addressed everybody's concerns and questions. The video is on YouTube, so do feel free to refer to it or share with others afterwards as well. But Jazakallah khair, and sincere thanks to all speakers for all of their excellent contributions and presentations. I ask that Allah subhanahu wa ta'ala accepts all of our efforts and their efforts in particular in this difficult time. And I hope that the information that was presented was of help and answered many queries. And as I mentioned, the video will be on YouTube, so you can refer to it in future as well, inshallah. But I think we'll call the session there, inshallah. Jazakallah khair, everybody.